guys, we're gonna have us a little break room mukbang and talk about our shifts so far. I'm eating some ramen noodles. I have not had any of these since, I don't know, since my surgery, so I'm gonna let these sit for a minute. I know I'm not gonna be able to eat the whole cup, but I am cold. This is gonna be good. So I am working on mother baby tonight, and I have 6 patients. I have 3 moms, 2 babies. Let me turn this TV down. There we go. I have 3 moms, 2 babies, so 2 couplets, 1 postpartum patient. Her baby's in a NICU, and then I have a GYN post-op patient. So when I first got here, I only had 5, and then around 8 o'clock, my GYN patient came up. She was a laparoscopic total hysterectomy. So she's doing great. And then I have my mom, whose baby is in NICU. She's been here for a while. She's having issues unrelated to postpartum, but we're keeping her on the floor since she is a postpartum patient. But she has a PICC line, and right now she's getting TPN. But she's stable. She's, good or whatever. And so my other 2 moms are new postpartum C-sections. They both delivered less than 24 hours ago. So one of them, I already removed her Foley catheter, and she's up. The other one, she wants to keep her catheter in a little longer, so we'll do that. And then one of them I'm kind of concerned about because her hemoglobin has dropped down to like 7.8, I think. I'm not going to call the doctor, though. We'll just see what intervention they want to do for day shift tomorrow, because it's 2 o'clock in the morning, so it's not like a critical low hemoglobin, so she's not having any symptoms. So yeah, then both of my babies are Coombs positive, which means they're at risk for jaundice or anemia. So I already did their labs, their follow-up labs, and they're good. And then one of my babies, I'm having to do NAS scores. So it's the neonatal abstinence syndrome, like when babies are test positive for any kind of opioids, or let me see, what else protocol we have to do. I don't have the book, but usually when they test positive, give me just a minute. My work phone is ringing. It's Tamika. Yes, you were. Did you leave it in the hat? Okay, perfect. I'll come empty it, okay? Do you need me to bring you anything? Oh, yes. Yes. Sure. Okay. Thank you. Bye-bye. I'm taking a break, so she's going to wait a few minutes. Yeah, I'll go in there after I finish my break. So all my patients are so sweet. One of my babies will get 24-hour testing done early in the morning, like right before I leave. And then what else I have to do tonight? I think that's it, really. So just regular postpartum care, 24-hour testing. All of my patients are getting IV fluids, so I refreshed their bags of fluids. I've really been running since I got here. I just sat down and caught up on my charting, so that's good. And hopefully after I finish eating, I'm going to do a round, check on everybody past my 2 o'clock meds, and then I'm going to hopefully get some homework done for at least 2 hours. But yeah, all the babies doing good. Mommy's doing good. So this will be part 1 of tonight's shift, and then I will come back in the morning when I get off and let y'all know how the second part of my shift went. And that will be for VLOGtober day 19. We are doing so good. I'm so proud of myself. We're supposed to be doing a mukbang, and that was my first bite. But I know I'm not gonna be able to take many bites. Let me see. Let me tell y'all some more information. So, got my little clipboard. We're gonna protect patient. We're gonna protect patient privacy. We're not gonna show any patient information. Disclaimer. So when we have a GYN patient, we get the report sheet. I can show you what it looked like because I have not even completed this report sheet yet. But it looks like this. I'll have this completely filled out before I give report to day shift. But this is what we get on admission with a new patient, GYN, like our post-op patient. And we just put the date they were admitted, the diagnosis, their allergies, their diet, their activity, whether they're up at lib, on bed rest, bathroom privileges, or whatever. And then we put their blood type, their history, like their past medical history, which my patient has a extensive history. And then we put what labs are ordered and pertinent results, any medications, what she's getting, Tylenol, gabapentin. Is she getting ibuprofen? I can't remember. But I know our normal post-op, no, she's not. Our normal post-op pain meds are Tylenol and gabapentin. And then we have PRN, oxycodone as needed. But I offered it and she's like, no. And then we put any radiology or ultrasound orders that are in. We write it on this paper, but she doesn't have any follow-up imaging. And then on these squares at the bottom, we pretty much just put like the last time we medicated the patient, any updates we need to give to day shift. And then for I can't show you, I'll try to get an empty report sheet and show y'all our postpartum report sheets, and I'll show y'all the newborn report sheets. So for moms that come up, we have a whole report sheet. So it just lists their allergies. We need to know their gravida or G, and then how many kids living, L. So it's, the GPAL, gravida, para, abortions, or living. And then we do their EGA, which is their estimated gestation age, and then what time they ruptured, the color of the ruptured membranes, whether it was meconium stained, bloody, or clear, the delivery date and time, did they deliver a male or female, is the baby in a newborn nursery, which is on our floor, or NICU, the type of delivery, whether it was vag, VBAC, C-section, did they get a tubal, the incision type for C-sections, or if they had an episiotomy, or if they tore or had a laceration. We want to write what degree the laceration is. And then we do the dressing type for the C-section incision, which most of them are open to air, or they have like a Mepilex or Aquacell dressing. And we put if it's with glue. And then anesthesia, whether it's spinal, epidural, general. Blood type is important. Their EBL, or estimated blood loss. GBS status is important because if mom was GBS positive, mom would need to be treated with antibiotics during delivery to make sure that GBS isn't transmitted to the baby. So adequate treatment for GBS is at least 2 doses within a time frame of antibiotics. And then we want to know prenatal labs, rubella, if they're immune, equivocal or non-immune, hepatitis B status, syphilis, HIV. And we check syphilis, HIV. They do it during pregnancy, and then we do it again when they come in labor. Any past medical history or problems that they're having on admission. The type of diet, whether they need ROGAM. That's why we check the blood type to see if the mom will need ROGAM. We check whether mom is feeding breast bottle, if she's pumping, if she's done skin to skin. And we also encourage them to watch the educational videos. And then we mark off their voids. So after delivery, for vaginal deliveries that had an epidural, we want to monitor their urine output. We want to measure their urine 3 times. With the C-sections, if they had a Foley catheter, we monitor their urine output for 24 hours. We write if the Foley was DC or if they still have it, any SCDs or the SCDs, compression devices to protect against blood clots, help with circulation. If they have an IV or INT and where it is, and if they have any fluids, the rate and what's infusing. And then we offer vaccines at discharge, Tdap, flu, pneumonia, or rubella. And then we write the labs, hemoglobin, hematocrit, platelet count, white blood cell, or any other labs that was ordered, or any other abnormal labs. And then we have boxes for 7 a.m., 7 p.m., like which shift, and then we write down the last medications that was given on the shift so that the oncoming shift would know what medications are due first on their shift. So for example, at 6:30 a.m., I'll write like what time I gave my patient her last Tylenol or Motrin, oxycodone, or whatever other kind of medication. And then we have a spot at the bottom for other information. So that's the mom. I'll make sure I get a blank copy and I'll post the picture so y'all can see a blank copy of the report sheet. And then for the babies, I have noodles stuck in my braces, I'm sorry. For the babies, we write down the mom's information just in case. Like sometimes the NICU nurse will come up here if we are short staffed and they'll just take the babies, or sometimes we split our patients where we'll get some moms and some babies that's in other rooms. So it just depends on how the assignment is assigned. So we write down the mom's information on the baby sheet too. All the mom stuff that will have an effect on the baby, like how many pregnancies, the EGA, what type of delivery, what time she ruptured, was it clear, was it meconium, the delivery date and time, the baby's APGARs, whether they had a nuchal cord, if so, how many times, was it tight, was it loose, was it vacuum assisted delivery, was it a cold delivery, the reason why the NICU team was there for the delivery, and then the maternal history, whether it was a walk-in, no prenatal care, walk-in with prenatal care, drug use in pregnancy, maternal fever, chorio, which is when they're suspecting infection of the amniotic fluid. Did mom use asthma medications during delivery, any gestational diabetes, hypertension, term labor, or terbutaline used during pregnancy, because those would mean any of those maternal histories. I got pasta, sorry. Do not get braces as an adult, okay? Anyway, so those maternal history things that I mentioned will mean like the baby need extra intervention like chem strips, because that put baby at risk for low blood sugar. So we'll check the baby's blood sugar. If the baby was LGA, large for gestation age, or if the mom was diabetic, we'll do 12-hour chem strips, which is blood sugar checks. And then any of those other things I mentioned, which is actually some extra stuff on here, I'm not going to read it all off. We'll do chem strips or blood sugar checks for 24 hours. And we do checks every 3 hours on baby, which is just a heel stick, and we check a glucose, just like when a patient has diabetes and we're doing a finger stick to check the sugar. And then on the other side of the paper, we write the pediatrician on call, whether the baby was a male or female, the baby's identification band number, we'll write it on here, and the security tag number, we write it on here and we verify. And then we write the baby's weight in pounds and grams, whether the baby was LGA, AGA, or SGA, large for gestation age, appropriate for gestation age, or small for gestation age. We write their head circumference, their chest, and their abdominal, which they do all that. The NAT team, the newborn assessment team, do that downstairs before the baby even come up here. We just check their weights once every shift up here, like once every 24 hours. And then they have the infant vital signs, like right after delivery. I think they check it 3 times before baby come up here. We check vital signs on babies within the first 24 hours. We check them every 4 hours. And after the 24 hours, we check them every 8 hours. And the same with baby assessments. And the same with moms as well. We check whether they got the eyes and thighs, which was the erythromycin that every baby gets unless it's declined by the parent, or the vitamin K, which is thighs, the injection that all the new neonates get after delivery to help with clotting. And then we write whether they got a septic workup at delivery, which is like blood cultures based off the maternal history. And then some babies need their hematocrit checked based off maternal history. And then it's a lot, y'all. We check maternal labs off on the newborn sheet. Her hepatitis B, HIV, drug screen, syphilis, all that is wrote on here. And if she was treated for GBS and how many times. We write the mom's blood type on here, and then if the mom is, we check the baby's blood type as well and their Coombs status. So like I said, both of my babies tonight are Coombs positive, so they need extra labs to check for jaundice or anemia. Okay. Moving right along. And then we write what type of feeds babies are getting, whether it's breast, bottle, or both. If they peed or pooped, voided or stooled, whether they're getting chem strips, any fetal anomalies. And then on this little sheet we have on the front, it lets us know if the baby has been seen by the pediatrician, if they want the hepatitis B for the baby, if the baby needs a car seat test, if they're below 37 weeks of gestation, or if they are below 2,500 grams, they are required to have a car seat test by the state law. And we check off if their newborn screening was done, which is the MDT, the CCHD, or congenital heart disease screen, or their hearing test, whether they passed or if they need a repeat, if they had a bath or it was declined, if their cord clamp was removed, if a baby had urine drug screen, we write it on here. If they did, we send off the meconium as well, which is the first poop. We put on here their 24-hour bilirubin level that checks for jaundice. And we write on here whether the baby boys will get circumcised or not. And you also mark which OBGYN did the circumcision, what time, and then we check after the circumcision. We do a 20-minute check, 1 hour, and a 2-hour check. And so that's all wrote on here. And any kind of consults that baby need, like cardio or anything. And that's it. That is my job in a nutshell. So you know what? This video is 20 minutes. I am actually not coming back on here for because it's already 2 o'clock. Hopefully nothing eventful happened between 2 and 7. So I'm just gonna wrap this up, finish a couple of bites of my noodles. But thank you for watching. If you have any questions, just leave them in the comments. If you have any video suggestions, leave them in the comments. Like this video please, and subscribe please. Thank you so much, and please look forward to my next video of Vlogtober, and y'all take care.